I'm Michaela Tremmel. I'm a physical therapist assistant. I work here at MMC Medical Center in the rehabilitation department. I've been working here since 2009 and have been doing aquatics since 2010. I first became interested in aquatic therapy when I was in college. I actually did one of my clinical rotations in the aquatic setting, and since then have taken different classes to learn a little bit more about specific techniques. Some of the differences between land and aquatic therapy is aquatics is much more than just doing exercises in the pool. We use specific properties of the water to benefit the patient. And it's much more than just swimming. Sometimes that's a misconception, is that aquatics is swimming in the pool. We rarely actually swim for therapy. So someone that might not know how to swim is definitely able to get in our therapy pool. We have a shallow water pool, so almost everyone can touch at least some end of the pool. We have two different levels in the pool, so one is about 3 foot deep and the other is approximately 4 foot deep, and we can raise and lower the water levels to accommodate for that patient depending on the goals there. If we want more water for increased buoyancy or less for someone shorter, or to transition to land-based therapy.
Hi, I am Michelle Mulligan. I am a physical therapist assistant here at MMC Medical Center in the rehabilitation department. I have been employed here since 1997. I became a therapist in 2011 and was introduced to aquatics in 2012. With aquatics, we work on balance, gait, range of motion, and strengthening. With the balance, we can work on static, dynamic, and turbulence. Turbulence is when we turn the jets on in front of you and we have you hold that stance. Gait is your walk pattern. With your gait, we get visual feedback from our cameras, and then we can see if you're doing a heel-toe pattern or if you're dragging your foot. So then we can give you feedback as to what you need to do to correct that. With range of motion, the water helps with the joint stability and mobility. And with strengthening, we use kickboards and dumbbells that you can drag through the water to help with build your muscles for strengthening. We have the massage hose and the parallel bars, and we also have a lift chair if someone cannot go down the stairs. And we also have the jets.
Some specific aquatic techniques that we use include I Chi, which is a series of exercises working on balance, coordination. Also can help with pain control by incorporating breathing techniques. Another technique is called Halliwick. We use different principles from that to work on balance and control as well. And another one we commonly use is called Badragaz ring method, or commonly called just Badragaz. It's a technique where we have a patient suspended in water with flotation devices. So someone that might benefit is someone with increased tone or spasticity, such as cerebral palsy, where they have a hard time coming out of a certain position, so that really helps them to relax. It's a great way to start the session. Some of the reasons why we would get someone in the pool versus land is the physical properties of water. So some of those include buoyancy. That is a force that's opposite of gravity, so it's helping to unload the body weight, making it easier for that patient to move, hopefully with less pain and restriction. Another example would be using resistive forces. So our body responds and moves a lot differently in water versus land. Water is much thicker than air, so that is creating resistance. And you can do that in various ways by adding your equipment, moving faster through the water, increasing the distance that you have your body or your arm or leg away from where you're moving. And so another reason why resistive forces is beneficial is working on balance exercises. So we move slower in the water, so that allows for increased reaction times. It's a much safer environment to work on balance exercises because they have that longer time to respond. And if they would lose their balance, probably just going to get wet versus actually falling, which could happen on a land-based session.
The properties of aquatics is hydrostatic pressure, and that is basically like a compression garment. So it exerts pressure onto the body. It helps with to control the swelling, it helps reduce the pain, and it helps to increase circulation. And the temperature of the pool is usually, we try to keep it around 92 degrees with the humidity around the pool 3 to 5 degrees higher.
So we can see a lot of different patient populations. There are a few reasons where we might not be able to see that patient in the water. Would be if they had an infection or open wound, if they have an unstable medical condition, if they were incontinent, not able to prevent when they needed to use the restroom, and if they had a severe fear of the water and just could not adapt to that environment.